My name is Andrew. I am 54 years old. Now I am a part-time musician, so I dedicate a lot of my time to music, learning music, playing music, teaching music. You have to start all the way back at the beginning. My condition is called myalgic encephalomyelitis, which is quite a mouthful. That is a diagnosis by exclusion. So when I tell you that I have seen hundreds of doctors and specialists, it's not an exaggeration, hundreds. None of my doctors had ever mentioned to me that this was even an option. They talked to you about more traditional approaches to things. I was lucky enough that someone who has my exact same condition tried this. And that was the big thing when she was like, it really actually worked for me. You know, when you've gone for years without having real hope, putting hope on the horizon is like such a huge, I can't even explain to you how important that is. And so it was always just there in the back of my head. And I had had these conversations with my wife about it, like maybe we can do this. And so my wife is a very busy person. I was taking her to the airport in Newark. And on the way back from Newark, there was a billboard. It was like Keta MC. And I just knew like, oh, this has got to be like a ketamine thing. As I'm sitting there, I pick up my phone, talking to Google inside my car. I'm like, Google, send me a message, Keta MC. And I rattled off the phone number from the billboard because I wanted to find out more about it. So on my way to my house, I'm stopped at the light and I look over, there's the actual sign on the building. So it was like the universe was putting this in my face. You know, all the dots just kind of like led right to that moment. So I was like, okay, I can read the writing on the wall. So then I made the phone call and had the consultation, and then things kind of just went from there. For me, it was definitely the third visit here. The way that my thought processes worked is that I would get really down about things. Like there wasn't really a lot of hope for like what tomorrow was going to be, because it was going to be exactly like yesterday and the day before and the day before. And it's been like that for years. At first I was worried, like, what if this doesn't work? And my wife was like, what if it does? And that was kind of like the big impetus, like, okay, let's give this a shot. That sense of hopelessness, that's really the tough part. As a patient with myalgic encephalomyelitis, a lot of your time is spent thinking about all the people that you've disappointed and let down. And so that was a big piece of it, feeling like I'd just been this colossal failure. And all, like the life I envisioned for myself and the house in the Hamptons, like all that evaporated. And so those thoughts I brought here with me, the negativity. And so the first couple sessions, it really was like these thoughts, like not only now am I wasting my wife's time, I've got office staff, I've got a doctor and a nurse, all these people looking after this person who's just not having a great day. And it's just like, go back and, you know, get your head on straight. Those were the thoughts that were in my head. And it was so loud for the first couple sessions. And then the third, it was like a little tiny blip. It was just for a couple seconds and then it was gone. And now those same thoughts that used to plague me every day for all day are just gone. Those thoughts stopped. That has been such a relief. Now, even when I'm not here, those thoughts just don't occur to me anymore. So that was a huge, huge shift. I have a routine that I go through every day, and it's just been that way for a long time. Having a place that I can go to, like Keta MC, where I'm stepping out of my normal routine into kind of an unfamiliar environment, but a place that's like welcoming and friendly. And I feel like I'm given the space to just exist in my condition and not have people like glaring at me, or, you know, not feeling like people are judging me. Like, oh man, it's a nice place to be just for that alone, where you walk in and you're not waiting for people to puzzle it out. They're not looking at you like, you know, like, what's going on with this guy? Why does he have this condition? They just accept, like, hey, you've made it here. You know, like, let's make the best of this. It's helpful to me to just know that, again, like there's a space where I can step out of my routine and be in a space that is literally for me. Being able to step out of routine and have a space where you can just be, it's awesome. A lot of times I think about medicine almost like a factory, like we're just trying to crank through patients as fast as possible. And that is not what it's like here at all. Here you're in your own room. They give you your own environment, and they say, like, take as much time as you want, stay all day. This is your space. Normally, like when you go to a doctor's office, it's sort of sterile and institutional. I don't mean sterile meaning clean. I mean sterile like not warm. It feels just institution white, like you're going into this place, and it feels more like you're a part of a process. You go to the waiting room, you're sitting there with 400 other people that are also waiting for the doctors and the nurses who are probably already tired of seeing patients by the time they've seen you. Here, it's not like that at all. This isn't like a doctor's office. There are doctors and nurses here, but it doesn't feel that way. It's much more like a spa. That's the only way that I can describe it. Like the furnishings, the wall decorations, even the floors and the colors and everything else is just warm and inviting and relaxing and comfortable. It just feels more like a retreat than it does like an office visit, if that makes sense. The biggest difference for me so far has definitely been the rumination side. When you think about hopelessness, you start to dwell on things of the past because you don't have any reason to look into the future. So I would be sitting and reading a book, and I couldn't even get through a page of the book because I had these thoughts about things that happened 20 years ago. Like, why did I say that during that conversation with that person? Like, that's a really tough thing to deal with all day long. You're just getting bombarded by the past and things that you wish you had done differently, or who do I need to apologize to? Those are all the things that kind of, that was my daily experience. So having that not be the daily experience where I am starting to look forward to things, like putting things on my calendar now and like having things to look forward to, that's a huge difference. Not only just hopefulness about the future, but being able to put things on the calendar and know that I'm going to go do them. When you're unreliable, people stop inviting you to things, you stop doing things, you become socially isolated, you become professionally isolated. And so you stop having things to look forward to. So now having things to look forward to, like having music lessons on my calendar, those were things that I never would have done before. I would rather stay in bed. And so that's a huge difference. There was a lot of negativity in my day-to-day, dwelling on negative things and feeling negative about myself and feeling negative from the perspective of people outside looking in at my situation. I don't think there's an artificial sense of positivity, or the ketamine hasn't resulted in some kind of false sense of positivity, like rainbows and Smurfs and all that. It's just not like that. But the absence of negativity, that is by far like the biggest difference in your daily experience, not having that hanging over your head all day. It's the relief. That's the biggest part of it, is the relief that you feel from not having to fend off those negative thoughts. All kinds of medications we tried. For the energy part, I had Adderall, Effexor, Wellbutrin, Paxil, propranolol, like all these different medications that were tried without really any success. Provigil was another one. And they just kept trying and trying and trying. And really, that was kind of one of the challenging things, was realizing that no matter what I was doing and no matter how stringently I followed the recommendations and the medication guidelines, it just wasn't helping. When I started to hear about ketamine, one of the possible benefits was what they call neuroplasticity. From any learner's perspective, I'm not a young man anymore, I'm in my 50s, and being able to process new information and put new information into your brain, first of all, really hard to do with myalgic encephalomyelitis, and then age-related brain decay doesn't really help either. So having that aspect was really encouraging to me. So what I really focused on was the way that neuroplasticity works, because if you do the same routine, it's kind of like wearing a groove in a road. You're always going to follow the groove once the groove is there. So for me, the idea was take a completely different road. And so the doctors were very clear with me when I got here. They didn't want me to just go home and sit on the couch and watch television. Like, you need to be active. You need to go do things that you haven't done. You're making new pathways. You're making new neural pathways in your brain. And so that's exactly what I did. So I would go home. I would look at types of music that I never had listened to before. I would listen to specific recordings of songs that I knew that were completely different arrangements, just ways to shock my brain into rethinking, re-examining how everything was. So yes, I did put a lot of energy into music, being able to play and being able to put things, not only just the way that I thought about the music, but the way that my body responded to how my thinking was. I've already been able to, this is yesterday. So I'm practicing a really tough piece. It's on bass, but it's a really tough piece. And I was able to do it yesterday for the first time. And while I can't say that ketamine definitely was the cause of that, I wasn't able to do it before. So to me, that was a single point that resonated because it was something that I wasn't able to do before. I had not even looked for other ketamine clinics. And the reason why, when ketamine first started gaining traction for myalgic encephalomyelitis, there were a few places that were doing it medically, like Keta. There were also a bunch of places that were not doing it in the same way, where it just kind of became like almost like medical marijuana, where people were just going in and then who knows really what they were after, what their experience was. And that really, for me, was a major turnoff when I didn't even pursue it at that point, because like, how am I going to determine whether this is a legitimate facility or they're just another ketamine place and send you out the door? So when I started to look at Keta, and I realized, not only, like, you cannot just make an appointment here. You don't just call up and say, I'd like to come in and give ketamine a try. It doesn't work like that. So you need a history of all the things that you're bringing into this experience. You need a sign off from other doctors, and you need to show that you have a history of all the other things that you've tried before they even let you in the door here. So that, to me, set the professional standard, and that set the tone for what I was going to expect from the rest of it. And it made me feel comfortable that this was legitimate and not, I don't want to say recreational, but almost like, it just felt much more professional. So it wasn't that I had looked at other places, is that I specifically avoided looking at other places because I didn't really know anything about it, but I had heard the nightmare stories. So looking at Keta and finding out how the process worked, having the number of people that I had to speak with before I even got to walk in the door here was like incredible, because it was like the initial consultation, talking to the doctor, talking to the therapist, before I could even make an appointment. Those, like, everyone had to sign off like, yes, we think this is a good candidate. So that for me was really comforting, and I didn't really need to look anywhere else. There are answers that your doctors may not give you, and you can find them here. And the things that are revealed to you about yourself during the process, you learn a lot about yourself when you're sitting in the chair and you're having the experience. And it really is like pushing the reset button. It's like all the things that have troubled you before, all the things that plagued you, you have an opportunity to reset it, to go back to zero, and then define what your next steps are going to look like by changing your outlook, by changing your behaviors, by changing your patterns. I think for a lot of people, and myself included, you don't just arrive at ketamine by mistake. You don't arrive here. You get here at the end of everything else that you've already tried. And so that is probably the biggest thing that I would tell someone, is that if you're nervous about it, if you're not sure about it, you know that you've tried so many other things. You have to ask yourself, do you actually want to see a hope? Do you want to see a better tomorrow? And if the answer to that is yes, then you can set your nerves aside and just be a part of that process. You've already tried everything else. Believe that you're investing in yourself and make that investment, because it's worth it. You're worth it,